Hello and welcome to another episode of Navigating Cancer. I'm Dr. Joey Bennett from the Robert Boisseneau Oncology Institute, joined by Wendy Hall, who is our licensed clinical social worker, cancer navigator, public relations
And I'm so
guru.
glad you're here today.
I know. I have been absent for a few shows because of scheduling and everything, but
we probably lost all our following.
we think we're back on track, and Steve, who is our producer, I think is happy that we're back on track as well. So thank you again for tuning in to today's show. We're going to do a show today talking about pain management, and specifically looking at it from a standpoint of cancer. Pain management is a really hot topic right now because there have been so many of these so-called pill mills in the state of Florida, physicians who are just writing prescriptions for profit and giving people these medications, and those medications then turn around and are sold on the street for illegal purposes. And so a lot of physicians are now shying away from wanting to write narcotics. They try to stay away from that entire class of drugs. From a standpoint of being an oncologist, in our practice, we can't do that. We have to make sure that our patients are comfortable. So today's show, what I want to do is talk about what some of the causes of pain are, and then spend a little time talking about different methods of actually controlling the pain. And on a future show, we're going to have Dr. Mark Hashem join us, who is a board-certified pain management specialist, and we'll let him go into some detail on some of the things that I can't do just with a prescription pad. So it should be interesting. And you know,
very important, yes.
Well, I mean, a lot of what you do. I mean, you're sitting there talking to patients, and a lot of the things that they complain about or problems that are affecting their life are pain-related.
Exactly.
Yep. So,
right.
First of all, there are a lot of different causes for pain. From a cancer standpoint, you can have tumors that push on nerves and push on bones and can cause pain directly from that. Sometimes after chemotherapy, you can have pain, sometimes a neuropathy or nerve-type burning sensation from some chemotherapy drugs. Radiation. Once the tumors are killed, sometimes you can have scar tissue that develops, and it can cause you to have pain. Plus, some of our patients will get skin reactions that are uncomfortable. And then after surgery, there's always that possibility of having pain after you've had surgery done. Sometimes it's a phantom pain, sometimes it's a real pain, but lots of different things that we can talk about how to treat them. We look at pain in several different categories. One thing that we look at is what we call somatic pain. And I tell people this is that deep, dull pain that you can have in your belly sometimes, or if you have a bad bruise on the muscle. But a lot of times it's what cancer patients will experience as well. And they'll tell you they're hurting, but sometimes it's a little hard to describe exactly what the pain feels like. Another type of pain is called visceral pain. This again is kind of a deep pain, deep inside the abdomen, maybe deep inside the chest. Often it's not well localized to one certain area. A lot of people will say, I just feel this pressure or this deep squeeze on my body. And so that is another type of pain. And the reason we're bringing up these different types of pain is that you approach them in a different fashion. Another type of pain is neuropathic pain, and neuropathic pain is not showing up very well on the slide, but this is when you've got a nerve that is actually being irritated in some form or fashion, either from the cancer itself, from maybe your chemotherapy. Neuropathic pain, a perfect example of this is shingles. Wendy and I see this all the time in the practice. When we have patients who have had shingles, they'll often describe this burning, stabbing, stinging type pain. And that's what the neuropathic pain is. It's usually something that just shoots down your leg, shoots down your arm, and it's managed completely differently. A lot of times narcotics, Aleve, Advil, and things like that don't work very well for it. So there are lots of different ways of looking at it. You can have also, from this standpoint, you can have nerve damage from your treatments. I talked about that a few minutes ago. Nerve damage from the chemotherapy, sometimes nerve damage from radiation or surgery. And again, it's that shooting, sharp, pins and needles type pain. And again, the shingles is the perfect example of what it can be like. Another thing you can see is chemotherapy induced. There are certain drugs, such as the platinum drugs, vincristine and vinblastine, which are medications which can cause people to have neuropathies. And then surgery again, we went into that earlier, but sometimes people who have lost limbs for various reasons will tell you that they still have this perception of pain in a limb that they don't even have. Sometimes women who have had mastectomies will feel pain in the breast that is no longer there. And post-thoracotomy is chest pain. It's when people have had cancer surgery for like lung cancer, or sometimes even like open heart surgery, and they'll tell you that they're left with this persistent pain that just won't go away. And sometimes I've had people who had a right-sided lung cancer who actually had pain over on the left-hand side. So
now, is that the same that diabetics sometimes get?
Diabetics can also get what we call the neuropathy. People who have high blood pressure, and specifically diabetics, the high sugar levels and maybe the high blood pressure over the years and years damage the tiny little nerve endings that are in the feet and the hands, and so they can get that burning, stinging, pins and needles type pain. And whether that pain comes from chemotherapy or whether it comes from diabetes or whatever, a lot of times it's managed exactly the same way. There are certain classes of drugs that work very good for that type of pain. The physiological effects, I mean the effects that you have on your body from pain are a lot. I mean, one, it increases the caloric demands. You can have poor wound healing, you can have weakness, you can have muscle breakdown because your body, when it's in pain, is just burning up a lot of extra calories. You can have someone who has decreased limb movement. If your hip is hurting, you're not going to be prone to walk, and if that happens, you're at an increased risk of a deep venous thrombosis or a blood clot in your leg. And if you get a blood clot in your leg, you can always have what we call a pulmonary embolus. That blood clot can break away and go to the lungs. You can have respiratory effects. If your ribs or something like that are hurting, the last thing you want to do is take a deep breath. And any of you who have had surgery done beforehand, you'll know that once you got out of surgery, one of the things they're doing is telling you to take some big breaths. Sometimes they give you the little incentive spirometer that you blow into. And what they're doing is making you expand those lungs, because if you don't expand the lungs, you're going to be at an increased risk of developing a pneumonia. And then finally, you can get a rapid heart rate. Anybody who has ever gone through one of these situations will know that, you know, you can have heart rate go up, your blood pressure can go up. Those are very, very common things when it comes to managing pain. And before we go to the break, I want to talk about psychological, and Wendy will cover this a little bit more when we come back, but pain can lead to negative emotions, to anxiety, depression. You're not sleeping well because you're not, comfortable. And then, there's just extra suffering. That suffering does not need to be there if you aggressively manage someone's pain. So when we come back, before we get into the drugs, we're going to also talk about some of the psychological aspects of pain.